Hello everyone, today I'm going to be talking about drug abuse or substance abuse. And what is drug abuse? Drug abuse is an umbrella term that can have different meanings depending on the substance that is being used. For example, it could be the use of illicit drugs, the ones we're familiar with: cocaine, heroin, marijuana, crystal meth. And there's this new drug in town in the United States. It's called flakka. This drug is produced in China and it's gaining ground in the United States. And I hope this drug is not in Nigeria yet. This drug is deadly and it kills instantly. Drug abuse could also mean the use of prescription medication that is not meant for you, or prescription medication that is meant for you but used in higher doses and in higher frequency. It could also mean the use of over-the-counter drugs, the abuse of some over-the-counter drugs. For example, cough syrups with codeine. These drugs are abused and people get addicted to it. They are used in higher doses and in higher frequency. It could also be the use of legal substances like alcohol, but then used in excess and in higher regularity. We also have drugs such as the painkillers. They are being abused. For example, the opiates and the opiums, they are being abused and people get addicted to them. People also abuse the use of sleeping pills like Valium, anxiety pills, and ecstasy pills. There are other unconventional substances that are also being abused. This is common around this part of the world. For example, people take the internal organ of a lizard. Yes, a lizard. They burn these internal organs and then they fill it up into a cigarette and they inhale and they get the instant high. People also sniff animal feces. People sniff gum, the gum that's being used by shoemakers. People sniff pit latrines. People inject scorpion venom. And then recently, I also heard of a situation where newspaper is piled up. We have newspapers piled up for many months, and then people wrap these newspapers and then they sniff it and they get the instant high. So there's so many things happening in our communities and also around us. There are also cases where these drugs are made into colorful candies and cookies, and then they're offered to children. Even adults take these drugs made into lollies. For those who do not want to inhale or inject into their body, then they take them as lollies and as cookies, and they also get the instant high. So we need to understand what is happening, around us. And what are the signs to look out for in drug abuse? They include hallucination, paranoia, involuntary shaking, itching, sweating, chills, dilated pupils, glassy eyes, red eyes, obsessive behavior, secretiveness, antisocial behavior, burn marks on the mouth. We have needle track marks. These are the signs to look out for in drug abuse. And please, if you notice any of these signs in anybody, please let the person seek immediate help. The person should be counseled and the person should seek immediate help. Oftentimes around this part of the world, we tend to link a lot of things to spiritual problems, home trouble, but these things are usually problems that can be treated medically. Like I said earlier, drug abuse is a brain disease, and there are medical and scientific advances to prove that drug abuse is a brain disease and it can be treated. there are different ways in which drug addiction can be treated, either by using psychological treatment or medical treatment. When I say psychological treatment, we look at therapies such as motivational therapies, behavioral therapies, community outreaches, where you have people that are undergoing treatment and people who are already living in sobriety. And when we have medical practitioners or psychologists who will come together and then, motivate each other and then help each other out. And then medical treatment could also be the use of replacement drug therapies, where some of these drugs are being replaced. For example, methadone is used as a replacement therapy for heroin. So we need to seek information and seek medical help where necessary. Please, if you see anybody who is abusing drugs, please make sure that you advise the person, you counsel the person, and if you cannot counsel the person, let the person refer the person to the professionals that are in charge of providing treatment. And who are the people that often abuse drugs, or who are the people that are prone to abuse drugs? For example, we have immigrants who do not have, the necessary documents to get good jobs. They get depressed because they are unable to meet their needs and they're unable to afford the basic amenities. They then get depressed and then go into the use of drugs. We have street children who also go into the use of drugs by peer pressure or are being lured by adults on the streets that are already in drugs. We also have musicians who use drugs to perform, artists use drugs to perform. We have veterans, and then a whole lot of people, abusing drugs. And even in our homes, people tend to self-medicate and then they get addicted to it. So we need to be careful and ensure that anytime we see signs of people using drugs or abusing drugs, we should ensure that they seek medical help. These drugs, some of these drugs are good for the body when used in the right prescription, with the right prescription, but oftentimes people abuse these drugs. The reason why I'm talking about drug abuse today is as a result of the sudden death, which has been on the increase lately, and these deaths are linked to drug abuse. And we also need to be careful because of our children, and we need to seek information and ensure that we play our roles as parents, we play our roles as neighbors. When you see your neighbors' children, abusing drugs, please don't keep quiet. Cry out, call the parents, and ensure that they seek treatment immediately. Thank you for listening. Bye-bye.